Good morning. This lecture is on clinical implication of agar impression material. We all know that impression is a negative likeness or copy in reverse of the surface of an object or imprint of teeth and adjacent structures for use in dentistry. There are so many materials are available for making impression. One of the material is agar, which is a reversible hydrocolloid. Which material is available in cartridge form, tube form, and bucket form in large quantities. It is a organic hydrophilic material. The setting reaction of agar is a thermoplastic one, which means agar gels liquefies in the salt state at the temperature of 70 to 100 degrees centigrade, and cooling it return to gel at mouth temperature, that is 37 to 50 degrees centigrade. Then for manipulation of agar, a special device is used, that is conditioning unit. It has three compartments: liquefaction compartment, storage bath or compartment, conditioning or tempering compartment. For preparing the agar impression material, we have to make the agar into small pieces and put it in the liquefaction pot and raise the temperature to 100 degrees centigrade. Within 10 minutes it began liquefied. Then we have to store the material at the storage compartment at 65 degrees centigrade. The material to be tempered or conditioned before the arrival of patient at 45 degrees centigrade. Once the material reaches the tempering point, we have to load the syringe material. Then we have to load it in the water cooled trays. There is a special device used for making impression, that is a water cooled tray. It has an inlet and outlet. Once the material is loaded into the tray, we have to place the tray into the patient's mouth and passing on the cool water through the inlet. Once the material passing through the inlet, the temperature in the agar material slowly comes down. When it reaches the dilation temperature around 37 degrees centigrade, the material started to cool at the temperature 18 to 21 degrees centigrade. It will become gel. So it will take about 3 to 5 minutes. Then the cool water which is passes through the inlet will become warm water and come out through the outlet of the tray. Let's see the properties of agar material. It will record the details accurately. It is a dimensionally unstable material. It has adequate viscosity to flow into the minute details. It will reproduce the details up to 25 micron. It is compatible with the gypsum product. It can be disinfected with 5.25% of sodium hypochlorite or 10% of iodophos and 2% of phenolic butyrolide. And the uses of agar, it is mainly used for duplication of cast, for FPD purpose, also for making impression for FPD. There is a important technique, that is vertical technique. How to handle this material? We have to disinfect this material with iodoform, sodium hypochlorite. We can strengthen the material with potassium sulfate. It is compatible with the gypsum product. The agar alginate technique is, we have to load the tray with alginate. Over the alginate, we have to fill it with agar material. This agar material will replicate the fine details. It will form like a thin laminate sheet. Advantages of this technique is it's a cost effective, less preparation time. The disadvantages is the bond between agar and alginate is not strong. Sometimes this alginate may displace agar. Also, it's a dimensionally inaccurate impression. For further details, you can refer the following books.